Okay. So we're back on recording again. And I'll start with the question is about, you already had about gastric cancers, correct? Gastric carcinoma, gastric cancer. So I cooked that one up first. And then we can flip down and do the other one. And then we'll work from here. Malachi had one, but I'd wait for him to be here. Uh, I always said Malachi. Is it Malachi? You know,
Yes, I'm here virtually.
a very famous actor had a sidekick. If you're a fan of Harry Potter, in the first two Harry Potters, the late Richard Harris was Dumbledore, and then and the guy who took over just died anyway, and they were both wonderful. Well, Richard Harris was gay. Richard Harris, he was a wild and crazy drinking Irishman, and his best friend was a guy named Malachi McCourt, who pronounced it Malachi, and he married a woman who was considerably younger, right out of my handbook. You know, no judgment. They named Ann Turkel. Look her up and see her.
How do you spell her name?
Turkel, Tuerkel. And I think he was married previously because his son, he's three sons who are all actors. And if you like the show The Crown, he played the father of the king, the late King George VI. And he was in, if you liked, it's perhaps my favorite thing HBO ever did, even on top of The Sopranos, was Chernobyl. He played the sort of the lead investigator, really the protagonist of that show. But that's why I pronounce it that way, just to explain where it came from. They all used to get trash drinking. Did you see her picture?
Yeah, she is pretty.
No, brother. She was all right. That's right. I was going to show you a picture of my two of my best friends from high school, both dated girls who were professional dancers. Jeez.
Sorry, just a heads up. Malachi said he's here virtually, but if you want, you can talk about his topic, but you can't hear him, I guess.
Okay, what?
He says you can't hear him.
Oh, he's on. Oh, I see. I'll do that one first because there really is nothing to watch. Hello, have fun storming a castle. And then see, boy, you guys are virtually there. All right. So I don't have anything to put on for. He was asking about, how you burn your tongue when you eat something hot. And it was just, what? Interestingly enough, the reason it takes a while to come back, but those are highly regenerative superficial cells that make up the taste buds, and the outer portion of the tongue is a kind of sort of modified, simple beg your pardon, stratified squamous epithelia. And so they are highly regenerative. You're constantly pushing up cells from the bottom, okay, toward the top. And so it typically takes about maybe as little as a few days or a day to get A, taste, and B, somewhat normal sensation, and maybe up to 2 weeks for it to be complete. It has more to do, it's really more of a question of, or an answer that's in the realm of the highly replicative or highly mitotic cells that are there. Assuming that the damage isn't so severe that it caused, if this is just a superficial burn, if you're getting in deep into the muscularity of the tongue, now you run the chance of getting contractures and maybe some type of surgical procedure. So hopefully that satisfied you. You don't have to, no faces out there. Okay, we're good. Moving on. Hey, he made a face. Sorry. I'd say cat got your. I'm having a lot of trouble with the cat. The cat is indignant that it is too cold for him to go out when he wants. He goes to the door and I open it up and he goes, no. And then 5 minutes later, it's like, it should be better. Like, it's my responsibility.
They do on purpose.
Oh, he does. He was sleeping at the foot of the bed on my feet.
Do you have that picture from Thanksgiving?
I should. I'll find it. Moving on. So the next question was digestive. So it's not that PowerPoint, it's this one. And so I was looking this up, and then we'll do the HIV one, which is the end of the one I was going to do anyway. So, and they get to it. I mean, digestive includes teeth, as you can see. and a variety of other things. So they spend a fair amount of time on dental caries. I don't. That's a very interesting area that I know very little about. This is where it starts. So it's they have some interesting statistics, and then I'll give you my spin on it. It starts with, for the most part, to summarize, gastric carcinomas are, so there isn't necessarily a common denominator. A lot of people think that this, the Helicobacter pylori, plays a significant role. I'm one of them. A lot of people think Helicobacter pylori plays a significant role in gastric ulcers. I don't think so. It's there in a lot of us. It's a very we if we eat food, depending on the source, so any type of soil or contamination in the food, you're going to pick up the Helicobacter pylori. That's why most of us test positive for it. So this was this guy, whoever drank cultures. If you're drinking cultures of bacteria, you theoretically should have your head examined. Okay, and most of the time they are not symptomatic. You don't notice it. It's whatever it's doing inside. Okay, look. I had more gastric ulcers than almost anybody. I never tested positive. And normally, when you start with the gastritis, the irritation, carcinoma is like an nth degree, and it may or may not have been preceded by any of this. But typically, chronic gastritis or the chronic presentation of an ulcer, particularly in the absence of treatment, is really predisposed. The big players for me for all of these things are things that irritate your stomach. The first thing they've told you for years: stay away from alcohol, non-steroidal anti-inflammatories. For years that meant aspirin. Certainly would mean ibuprofen. Stay away from caffeine of any source. And often they would say chocolate, because there's a fair amount of caffeine in chocolate as well. And if you stayed away from that and were guidelines with your diet, you did less. And alcohol and non-steroidals are the biggest players. And for me, the non-steroidals as well as stress were the big reasons behind it. I didn't drink. I mean, I didn't touch a drop of alcohol, I would dare say, for a dozen years. Okay? Easily. From maybe when it started in me in the later 80s, maybe up until 2000. And by choice. I never really, I'm not a big fan of alcohol. Just not. Which is why I always am amazed that my eldest has a server in his house that's filled with bourbon of every possible. It's the military thing.
He collects it, right?
Yeah, and drinks it. His refrigerator in the garage is dedicated to beer. Any kind of beer. It's an art. Sorry. I give up. But normally, the transition from gastric ulcer, if untreated, is really predisposing to carcinomas. So, and gastric ulcers are typically what we call peptic, because they're in the stomach, as opposed to duodenal. Yes, ma'am. Oh, hi, Howard. And here's the idea. Now, that's the debate. Is it Helicobacter pylori? It's gram-negative. It's micro. And why it survives, it secretes that enzyme called urease, which breaks up urea, which we have in abundance. It's how we transport ammonia from amino acids becoming free floater for protein breakdown. We deaminate and utilize it. And what it does is it breaks it apart, and that releases carbon dioxide, and with water, carbonic acid, and becomes its own buffer, which is why it survives in there. So it's already interesting in that regard. So this is what the guy did, who knows. Survives the acidity because of the urease, okay? And so it basically, by breaking it apart, you end up with ammonia, which is more alkaline, and it has the ability to survive in that mucus layer. And it's what I like to say, hiding in plain sight. You're hiding in normal tissue. And so, and a lot of things do that. And so then there's a variety, as you can see, there's a variety of toxic factors. And that's really the way bacteria do their business. Sometimes it's immunological, but most of the time bacteria are nasty because they produce toxins, okay, more than anything else, and damage epithelial cells, inflammatory response, long time. And statistically, there's a very high correlation with Helicobacter pylori. So I buy that stomach cancers come from that. I don't buy the ulcers. But they're showing you a little bit, it's curved, it's gram negative, it's its own subset. And what they did, they originally treated me with a broad spectrum antibiotic, and typically use what are called protonics agents, which block and we'll talk about that when we do the digestive proton pumps. So you can buy them over the counter now, okay, easily enough. So there's so many of them, and the trade names are everywhere. And theoretically they're once a day. The problem is when you stop stomach acid is your friend. It kills a lot of the stuff that everything else doesn't kill. So I got a salmonella infection systemically that put me in intensive care in 2006, and I was gobbling because my stomach was so bad. I was gobbling those like candy. You're supposed to take one a day. I was probably taking 10. I always had the philosophy, if one's good, 10 is better. Which is not good. And I'm supposed to be smart. Boy, are you a dumb doctor. And long story short, after that, I ate something that obviously was contaminated because it came here. And we knew it, and it turned out to be from lettuce and tomato. But it happened to be, and it affected Sheets' population. And I happened to get mine from Panera up in Butler County, though it really was there. Right up in Butler, where all the, if you're familiar with that like path that has all the shopping up in Butler, right outside the city of Butler. So, and there's a bunch there. That was my students in micro in a summer class. Oh, we're going up to Panera's, because we had like lab in between lecture. We had lab, then lecture, then lab. You want a sandwich? Sure. Here's a few dollars. Get me this. Got on the golf course the next day with my eldest. Couldn't get to the porta potty fast enough. That was a Tuesday. By Friday, I'm in intensive care. And I think I told you the story. They called my 87-year-old mother to say I was close. And I was. But you're so happy because I'm here. That was a very significant event in my life for my wife and I now. Only a person who loves you, because she had no standing. We were secret at that point. And so she couldn't really get to see me until she kind of snuck her way in. And the first thing she did, you would think here I was just out of intensive care, because the only family can come into intensive care. Oh, I'm so glad you're doing better. No, she started yelling at me. Don't you ever do that to me again. That's how you know somebody loves you. How dare you do this to me? You should have made known that if something happened to you, I'd have. Bless you, dear. So if you're wondering if you're really you're in it to win it with somebody, when you're near death, they'll hand it to you. So a lot of us have H. pylori. Numbers are greater than that. Okay, 80% of those people who are older, certain families. This has more to do with food preparation and buying affordable food. They think it's fecal to oral, but it's easy to get that. You can go to any restaurant. If they're not careful, you can get that. So don't blame that. Well water, that's a whole other sub issue. Folks around here, like Hannah, because you live relatively rural. Do you have city water or well water?
I have well water.
Right. A lot, and it's a whole different ballgame. Most of us, you go up to water, you're not worried about it. In the COVID, okay, that changed a lot of people's views, but most of us, I'm going to the fountain, I got to fill my water bottle or whatever. Okay. Well water is a whole different animal like that. My kids ended up with giardiasis when my first wife and I were away at a medical conference. I was studying for my orthopedic boards. It was a conference for that. It was in New York City. She decided to, on Fifth Avenue, do the shopping thing, which is probably why I have all that stress. Oh, they gave me his credit card at Bergdorf Goodman's. Oh, thanks of a lot. Right away, I didn't have to do anything. What did you get? Don't start. You wouldn't be like that. Saks, Bloomingdale's. I dated a lot of Bloomies over the time. But they were up there, and the lady who was my secretary, my office manager for 15 years, she was watching all three of them, and their well got compromised. So you have the whole thing. We have a reverse osmosis system on it and all that kind of good stuff, Hannah. Does that sound familiar? Yeah.
Yeah.
You know, because wells means you have a septic tank, and never the twain shall meet. So that's another issue. And so usually you use some kind of an agent, some kind of broad spectrum antibiotic. It just doesn't work in everybody. The problem with carcinomas is they're nasty. They're about the third most common cancer that we see in adults. So again, you're looking at, for the most part, lung cancer, particularly that cause fatalities in women, breast and male prostate, and then you start getting to gastrointestinal cancers. Okay, and so that's, so it's funny they characterize this here. To me, even because it's oral herpes, they probably characteristic here. Herpetic infection to me are both, they're transmitted by sustained, you know, they're effectively sexually transmitted by intimate sustained contact, saliva, whatever you want to call it. Okay, and it just is less severe, and I mean that's very typical. Most of us are very familiar with it. So I'm going to stop on that, and I want to go over to your. What was your question? No, Catherine.
Like what I sent you,
Yeah.
it was about AIDS.
Oh, that's right, the HIV thing. Yeah, that's. Thanks for refreshing. I had that cooked up. That's all the way at the bottom here. I'll give you a lowdown. Okay, so let's start here. So this becomes a wave of, and this is the real problem when we look at, when I teach micro and we do the clinical stuff. Okay.
I'm gonna go fill up our waters. See you in like 2 minutes.
You know, one person could take two.
No. It's okay. It's okay. It's okay. What if we get lost? See, it's good. It's okay.
And I had that discussion today with someone from a class before you. No, I had it with my buddy. I said, it's amazing. It doesn't matter what the class is like. But if you love going in every day because it's so much fun, that's your class. And think how much more fun it would be if we don't want to talk about her. That would be rude. Right. Mum's the word. You remember that expression? Any Galaxy Quest fans here? Never give up. Never surrender. That's almost as good as Spaceballs. Oh, it's hysterical. It's like a mockumentary, and they're coming out with a new edition of This Is Spinal Tap from the same people who brought you Best in Show and Waiting for Guffman. Oh, they're great. It's hysterical. You never saw Best in Show? You have to see Best in Show. It's hysterical. Moving on. So I'll give you the lowdown. The problem, and the way I frame it in micro, COVID is an RNA virus. RNA virus is the biggest problem we have with them is they mutate. Because RNA, when it's replicated, has, particularly inside of us, has very, very limited proofreading that's available. DNA viruses like herpes and HPV, their biggest problem is latency. Because they're compatible with our own DNA, they frequently incorporate in cells that they invade and change them and replicate along with them, so they become permanently incorporated. Once you're exposed to HPV or once you're exposed to herpes, you may never have another outbreak. It may never affect you again, but the virus is always part of it. Whether or not it affects you long term is a totally different and distinct question, which brings us to what HIV is. HIV, and most of you already know that, constitutes, and we go over this again to be fair in physiology, is what's called a retro or backwards virus. Okay, and what it does is an RNA virus that, when it enters the cell, certain viruses, COVID has it, others have it, is packaged with certain enzymes. The most notorious of those enzymes is RNA reverse transcriptase. And what it does is when it enters your cell, effectively, it releases that enzyme and it rewrites the RNA of the virus as DNA. And then that DNA can incorporate with your cells. So now I frame it as we have the worst of both worlds. You have an RNA virus that enters as RNA and then is rewritten as DNA. There's no proofreading. So immediately there's a massive problem with potential mutations, like an RNA virus. Yet once you contract it, you always have it because it incorporates with the host cell, many, many instances. And of all the cells, the single most important cell in your immune system, the helper T cell or CD4. In fact, it uses that marker, that receptor to enter the cell, to facilitate its entry in the cell. And then you have it forever. Now, therein is the distinction. You have HIV positive, and this was the misunderstanding. So I'll frame it. And I probably will frame it again somewhere down the road, but I do a whole spiel on this. And I graduated and got my doctorate in 77 in Philadelphia. I did a 2-year residency. For podiatrists, 2 years was long. There are only about maybe 25 or 30 2-year slots. And ours was a 1-year residency. They only selected 3. One of them was me. 2-year, second-year residents. It was rare. There was only 2 third-year residency. So I'm blowing my own horn again. Long story short, by that time, I met my first wife. We became serious. We met at the hospital. So she had an apartment in Northeast Philadelphia. I spent most of my time there and eventually didn't pay for my other apartment in South Jersey. She goes, I want to let you in on something. She goes, the guy downstairs, I'm his date for functions at work. He's gay, and they have the awards dinner and the Christmas dinner, and it's 1978. And you're not bringing another guy to the dinner as your date and dancing on the floor with him. And she goes, that was what the culture was like then. And because of that, I could care less. Is there a game on that night? I'll watch that. So already she was in trouble with a sports addict. Okay. Sorry. And this is PC. You know what that means? Not politically correct. Pre-cable. And so we became very, very friendly. And he had a whole network because Philadelphia had per capita the second largest gay population after San Francisco. And it's really where the disease reared its ugly head. And we were meeting people. We'd have a big thing. We started getting like a brunch and all of his gay friends would come over. And it was like, we're having a great time. And somebody would come in and that's so-and-so and go, and a lot of times they refer to themselves in the other gender, say she is really it doesn't look good. She's feeling sick. And the guy's name was Johnny turned to me and goes, she's got it. Well, what's it? It was something that was affecting that population back in 77 and 78. That was clearly hurting, clearly causing them to die, and they would succumb to multiple infections, and many people would, and you could see they'd weaken and die. Just look at the pictures of Freddie Mercury, Queen, and then Freddie Mercury in 1991, you can see him everywhere. Shadow himself, he diseases himself up. That was, so the distinction then is people thought erroneously it was a scourge brought on by the Almighty to punish gay people because that's wrong. And, you've heard every one of these things. If they end up going to prison and they're HIV positive, nobody would even go near them. We were afraid to touch them. We had no idea how it was transmitted. I mean, all of that thing, the stigma was immense because we had no idea and we didn't know there was a significant difference between HIV positive and AIDS. HIV, similar in the way to a bacterial disease called tuberculosis, is classified as slow. It takes 2 to 10 years from the point of infection without treatment in order to manifest itself as AIDS. By definition, HIV positive is not fatal. HIV doesn't mean you even have the virus in any of your secretions, not necessarily in your saliva or in your blood. It means, like anything that says hepatitis B positive or hepatitis C positive, without specification, it means you're testing positive for antibodies. That's what it means. I tested positive early on for hepatitis B antibodies, and even to some extent for hepatitis C antibodies, because my first wife encountered them from a transfusion. That was probably, spread sexually, through intimacy, but she got it from a transfusion back in 1981. I was doing blood draws when she worked dialysis. They had to be checked for hepatitis B's. We didn't really know a whole lot about C. And I was a good needle stick, so I would, all the nurses, I would draw their bloods once a month. Could have got it from that. Boy needs a little splash of the blood in an open wound. Didn't wear gloves. I keep telling you guys that. That didn't come. I know you're looking at me like, oh my God. It's like Hannah when I touched the thing in there without the gloves. You don't have gloves on.
That was gross, Stein.
Well, that's why the good Lord made soap and water.
Yeah, but the good Lord also created disease.
Which soap and water, with that kind of disease, washes off. It's an enveloped virus for the most part, and you don't have to worry about those. Moving on. You gotta loin some more. To say in my old neighborhood.
I'm sorry, what?
Loin.
I have to loin something?
Loin. Like Learn. Loin.
Learn?
Loin.
Okay. I'm having like
You're having what?
Learn? Okay, loin?
You gotta educate it.
What kind? You're in rare form today.
It was probably the burger I had last night. I'm a little more toward well done.
It was the burger? Good?
Always. Moving on. So we start with that nugget, that HIV, all it means is that and with the technology today, and even with the technology that's been around for the last 20 years in the pharmacology, it has been eminently treatable. And really the poster child for that was when somebody famous got it and was upfront about it and was treated. It wasn't like the Liberace and Freddie Mercury and the closeted people, because at that time for them to get jobs, for not to be, a large part of thank goodness, you're in a much more enlightened time to be here. It doesn't matter who dates who or when they come to the Christmas party or the office party. There's always going to be some idiot who's going to make little snarky remarks, but who cares? Okay? But that wasn't the time then. So that's what brought AIDS to the attention. In 1988, after a male action hero, Rock Hudson, action hero stuff, okay? Leading man, and I can't even tell you how many important movies. Was a closeted gay, and he succumbed to AIDS right around 1985. And it was all over TV. People were shocked. They were less shocked with Liberace because he was a little bit out there anyway. They were less shocked with Freddie Mercury. But by that time, it was, at that point, once the Hollywood community with all their money and political contacts managed to get something called the Orphan Drug Act passed in 1988. In 1988, it had nothing to do with orphans. What orphan drug meant, it was financial incentives and quicker processing, because it takes about 10 to 15 years to get a new drug. For a new blood pressure pill would take you 10 to 15 years. They've fast-lighted it, fast-tracked the thing. And so that was called the Orphan Drug Act. And then we began to see this advent of anti-metabolites that are very, very well known and around today. And then other, anti-enzymes where you have RNA reverse transcriptase inhibitors and protease, which is another enzyme, when we get into how it works. I don't know if this is answering your question or just giving you a background about the stigma, but the stigma was the lack of understanding. Oh, they're HIV positive. Magic Johnson got it, was out front, allegedly. He had, like a lot of pro athletes, they had a lot of sexual encounters. He maintains that they were non-homosexual encounters. Again, who cares? Okay. Doesn't matter to me. And became HIV positive. Effectively, it was the end of his career after winning 5 NBA championships. And he really came out in front. And that's when people started to hear the word condom being used a lot more. Okay. They had, people began to be a lot more, and that's perhaps the greatest problem in this country, is the lack of openness about sexuality. We are rather provincial for a long time. Parents were just not they weren't comfortable discussing that topic. You're talking to someone who's an unexpert about sexual behavior. I may know a lot about it scientifically. Did I mention about my daughter and my granddaughter recently? I have a beautiful daughter and a beautiful older granddaughter who's the same, perhaps a little older than you. She'll be 22 on the 3rd of December. Reminds me I better get a present. Money usually works. Hey, works for me. And my daughter, who will be, are you ready? 37 years old in February. Granddaughter's going to be 22. She's going to be 37. You get any idea? I thought 38, rather. I'm fond of saying, you do the math, 15 and a half. So if you're looking for an expert on openness about sexual activity, you're not seeing one in front of you.
My birthday's coming up. If you don't like giving out money.
Oh, when is it?
December 29th. It's in a month.
Oh, that's too, right around Christmas. Boy, it really hurts the presents, doesn't it?
I'm an only child.
I know why.
My mom.
Why doesn't that surprise me
My
at
mom
all?
stopped at perfection sign. That's what happened. That's what she says.
Oh God, my life would be much more boring without you.
Oh, you're welcome.
So you get the idea behind what things were like. So that is the backstory of why we saw this. So we were seeing it. And then finally they came out in 81 with the study because of the association with what are called AIDS-defining illnesses. When someone is HIV positive, effectively their helper T cell count begins to go down. Once it goes below a critical level, at that point they become an AIDS patient. AIDS by definition is fatal. We used to look at it as a relationship with what were called helper and suppressor T cells. We've changed the language, which you'll learn about when we do the immune system. We still have helper T cells. Now we call them regulatory T cells. And basically, your immune system is so powerful, if you don't shut it off, it can clobber you. So the regulator cells or suppressor cells would suppress immunological reactions. The trouble is, without the helper T cells, once they fall before a critical level, then they augment your entire immune system, and then a routine infection can be lethal. And frequently, that's what happens with regard to it. So we began to, as all of this developed in the 80s, we began to learn more and more. And then when Magic Johnson, I think it was right around 1991, when he, came out with that diagnosis, then we all kind of went, okay. Started to understand, yes, we can still hug and kiss each other. Yes, we can, if we're careful with things like that. And from many of you who are going to go into healthcare related fields, that's why it's so important to be aware of the chart. What goes on, if someone is HIV positive, you take appropriate precautions. Okay, if someone's an AIDS patient, now you have to be extra careful because that means that the viral load is going to be in their secretions, in their blood, in their tissue fluids. That's the difference. Now, all of a sudden, you're at a high-risk environment where you have to be. The odds on an HIV patient, statistically, and maybe it's changed over the years, a random needle stick when you're doing a blood or giving an injection to an HIV positive patient, probably 1 in 500 when you're going to contract HIV. AIDS patient, pretty close to 50-50. Same thing with what's called chronic hepatitis C. Someone who's hep C positive, first wife is hep C positive. Okay, it's still inside of her. They told her, and her health isn't great. That if it really deteriorates a lot, it could rear its ugly head. Her immune system's kind of keeping it under check. When she found that out, that's when we went to an infectious disease specialist, MD, up in Butler, by the way. And he said, look, once they tested, then they do a PCR test to see if it's in an RNA PCR, see if it's in the blood. And if it's not, then it's still, it's when it gets into your secretions, into your blood, and into a variety of fluids, not the least of which are associated with intimacy. That's when the problem develops itself. So that's the starting point. Let me get this. How do I get rid of this thing, whatever it is? Thank you. I never know. So this is, okay, backstory for this, just in case you're interested. There's a really good, and I've got to find it for you guys. There was something like on one of those science channels where they were, and this is where vaccine distrust comes from in Africa. if you can tell me why measles is the third largest killer in Africa. The reason is they made a polio vaccine and they were going to do it on site in a lab. Their lab had a dirt floor. They grew the virus in monkeys. It didn't matter if the monkeys were sick. They have a zillion pictures of this quote unquote lab. Disgusting, unsanitary, done on the cheap, no safeguards that you would expect a laboratory, go into a laboratory and Chiron Labs in Liverpool, where they make most flu vaccines, you're not going to see that. And they feel that this was a virus from a monkey that mingled with the polio virus, and voila, the fusion occurred. And that was probably the onset. And then they inoculated all of these folks for polio, and voila, now and this is, remember, 6-7 years, just probably 8-year-old. I say it's 2016 when this edition went to bed. 37 million live with HIV, mostly equatorial or sub-Saharan Africa, 120. Still not, and you can see the numbers are staggering. Okay? It just means, it does not mean that you're ill. You can be totally asymptomatic. It's very similar to some of these diseases that come, and there's really nothing acute. There's no rash, there's no warts, there's no sore, there's no drainage that's coming from the genitalia. And it takes a while. So and the trouble when something takes a while to manifest itself at all, it's an opportunity for people to have multiple partners. And it has changed a lot because of one thing HIV has done is made us much more appreciative of being careful with relationships. I'm trying to phrase it nicely. When we were, I think I told you this before. So I graduated high school in 1969, Woodstock. 67 was called the Summer of Love. The 70s were wild. So everybody was having what was referred to, and I don't want to offend anybody. So stop me if you feel that I'm saying something I should not. It was casual sex. It was one night stands. And nobody, the only thing they were interested in is what are you doing to not get pregnant? You know, people would come to say, oh, you know, I hooked up with so-and-so or this, whatever the appropriate vernacular was at the time. Everybody. And how rapidly did things like gonorrhea was everywhere. Syphilis was everywhere. We didn't even have a name for chlamydia. They called it NSU, non-specific urethritis, or non-gonococcal urethritis, because if it basically had the same symptoms as gonorrhea, but you didn't test positive. Same deal, same problems down the road. It's fascinating. So as you can see, it's a relatively mild presentation early on, and then it decreased, but it persists, and it goes through this latency period, and where it starts is critical. It's called the set point. So depending on your overall health and the severity, take somebody like Freddie Mercury, who ostensibly probably manifested itself full-blown in maybe less than 5 to 6 years. His set point, because of his lifestyle prior to that, was extraordinarily high. So, I mean, it wasn't the 10-year part, it was the 2-year part. By the time, in biographic, I've always had an interest in the great Farouk Balsara. Who wouldn't? I mean, at least somebody had a personality. And there's really some great stuff, and you can see it on YouTube or anywhere else about some of the parties they had.
Have you ever seen the Bohemian Rhapsody movie?
Yes, he was great in it. Guy was great in it. It's a little incorrect about the relationship he had with Jim Hutton at the end, who survived for a long period of time. It's a little incorrect about he was close with his mom, and it was different, very close with his sister. And the lady who he was basically a couple with until he came out, they stayed close forever. And it was just so much going on that people I mean, they knew he was sick, and Elton John had gone to visit him, and he came, and the paparazzi, a la Princess Di, okay, surround Elton John, and he goes, I came to visit my friend, got in his car. Period. And he'd been outed for whatever reason earlier because he owned a pretty good sized football club, soccer club, Watford, which is his boyhood club, which sort of jumps up and down between the Premiership and not. Okay. So there isn't a whole lot to it, but the set point's important, and that's where you start to people. There's a couple of shows that have done. There's been a lot of movies and shows that have done a pretty good job with this. There's one. As always, what happens these days. Did you ever see a show called Transparent that was on Amazon Prime? Okay, it involved an older man transitioning, and it was the actor is brilliant, but there's a lot of actors, and he had a lot of trans people on the show, and they were very old. It was more comedic than anything, but it dealt a lot with serious topics, and it ran for 4 wonderful seasons. And then some accusations came out about his behavior on the show, and I'll remember his name in a little bit. Jeffrey Tambor, who I've been watching, just a wonderful comedic actor who could do serious parts. Very unhandsome guy, but they really started to deal with what was going on because because a lot of people he was interacting with had transitioned. Many of them had where HIV positive had different viral loads. So he got a lot of information about the whole thing that was going on. So it was a fascinating show. And there was a couple of very good movies. Tom Hanks won an Academy Award for one called Philadelphia. Was there. Denzel was his lawyer in that particular one. That was, he won like Academy Awards back to back, that kind of thing. So there's a lot of information as time went on that I wouldn't say completely destigmatized it, but to give you an idea, as a kid growing up of what are called baby boomers. Okay, so all of us were born. Our dads were in World War II. They came back. They had kids. Generally, arbitrarily, born from, let's say, 45 in 1960. I was born in 51. My wife in 58. And all of her. We were all in that sort of neck of the woods. And I mean, if somebody had been committed for mental illness, a parent, the moms and dads didn't want you to go into that house. God forbid it was a divorcee. Think of that today. Stay away, because they're all, she's hunting for husbands. But the mental illness one was like that. They had no idea about how diseases spread. It was horrible. There was anybody who was outside the norm, and it was and I can't imagine what it's like for you folks with social media, particularly for somebody who is, if you will, different. But for us, it was, they were just treated poorly. And I can relate to it. I was the fattest kid in the class. Not so svelte now. But I weighed like 260 in high school. I've gained and lost people. Many people. So all of that's part of it as well. Time's almost up. So this is the idea. It's that the CD4 lymphocytes, those are the precursors to the helper. So when they went down, you could see what happened. The circulating HIV, the RNA virus from that, wherever the set point was, it was here. And that was the 2 to 10 year. And then all of a sudden everything went, because your immune system effectively collapsed. So it's very limited in weeks. There's not a lot. And that's a time when you can do a lot of spreading of that particular disorder. So there's more than one now, less HIV one, most cases. There's a lot of different, because it mutates. Okay. It's enveloped, and that's another misnomer. It's very enveloped viruses, COVID included, are very easy to get rid of on surfaces. It's a slam dunk. You just need to disinfect. You spray it with some alcohol. It's going away. It's like, oh my God, they were in the same room. That whole COVID thing. I just like wearing those masks for obscene times. I don't even want to get started with that, because I nearly quit of that until they finally lift the mask mandate. Kidding me? And so and it's unique because it's embedded with a lot of these, and these are all targets for antivirals. Okay, so these are proteins. We can make targets for proteins. And you can see the way it is here. It's a very unique, and that's the envelope. What makes that easy is it's made of fat. It's a membrane. You all know about that. Phospholipid bilayer, good to its mother. Its mom calls mom every week, every Sunday, and gives her a Christmas card. So, and they're easy to get rid of that. Soaps, disinfectants, doesn't matter. So it's pretty easy. And then, and they'll go through the whole thing. We don't have the time. Does this help? Does that answer some of your question?
Yeah, I liked a lot of the background because I guess I just didn't know as much as I could.
Well, I wanted to do for you guys, I'm not making a value judgment, but it's a whole different world. People aren't careful the way they should be. There's a great line from India, I'll leave you with that, from Indiana Jones in The Last Crusade, the one with Sean Connery. The knight, at the very end, choose, but choose wisely. And then at the end, when the guy who was on Game of Thrones, died, he goes, we chose poorly. All right, everybody. Have fun. Nice talking to you. Better stop my recording.